My name is Nicolette Carsillo, and today I'm going to talk to you about managing prescription and non-prescription medications in the athletic training room. The FDA is in charge of distribution and labeling of medications. The Drug Enforcement Agency oversees prescriptions, controlled substances, and disposal of medications. The Occupational Safety and Health Administration provides standards for contamination, and the State Board of Medicine regulates learning of distribution of medications. As athletic trainers, we are in charge of giving out medications and educating the athlete. Our medications are prescribed from physicians, and as an athlete, they must make sure that they follow the guidelines that we give them. It's their responsibility. And although we don't allow students and coaches to give out medications, if we did, we would need to require a written protocol of the responsibilities of dispensing medications, and the Athletic Training Association is in charge of annually conducting the review of athletic training facilities procedures. The NATA website has the policy and procedure of medication use on their website. We don't have a printout in the athletic training room, but I feel like we should print it out and keep it in there. And also, we have an emergency action plan that is kept in the facility. Medications should be kept in a locked cabinet, and I feel like we could do a much better job at keeping our cabinet locked. We have never really locked it, and Russ has agreed that he will try to keep it locked more. And also, the room that the medications are in should also be locked. And if there are samples or controlled substances, they must be stored separately from other medications. When away, medications should be kept in a locked kit, and they should be inspected routinely to make sure that they haven't expired or anything. The prescription medications are only to be accessed by licensed physicians, and non-prescription medications are allowed to be administered by us as athletic trainers. When away, you always want to make sure that you have written documentation of medications, and if you're going international, you want to make sure that you follow the FDA import and export laws, and always make sure that you're documenting all of administered medications. A DEA certificate is administered from the physician responsible for prescription medications, and it's not required unless the facility prescribes controlled substances, and we do administer controlled substances, but we do not have a DEA certificate, so we need to get a hold of one. Every medication should be properly labeled according to the FDA's 7-point label guidelines. That should have the name of the product, the name and address of the manufacturer, the net contents of the package, the established name of all active ingredients, the names of habit-forming drugs, the cautions and warnings listed, and the adequate directions of safe and effective use. Documentation should be kept for everything on paper and put into sportswear. On paper, your record sheet should include the athlete's name, the injury and illness, the medication given, the dosage, the quantity, the lot number, and the date administered. And for ionphoresis and phonophoresis, details should be kept in the rehab log. Inventory should be taken on a regular basis, and you want to make sure that you're keeping up with the medications distributed and ordered with an accurate available amount. It's okay to use prescription medications from physicians and patients for the treatment of multiple individuals as long as supply is properly labeled and stored. Procedures for this are reviewed with the physician, and for emergency medications such as EpiPens and inhalers, they're administered and properly educated directly to the patient who will perform the medication to themselves. Prescriptions should be properly disposed. Expired prescriptions and over-the-counter medications should be disposed according to the directions given from your physician that you obtained the medications from. There are alternative ways of disposing medication on www.fda.gov, and the way we dispose of our medications is we give them to the health center and they properly dispose them for us. And if you have a minor, you want to make sure that you don't administer any medications to them without proper parental consent that is written. And if you fail to administer drugs according to the state and federal laws, DEA regulations can be used to determine consequences, and it may even be extended to the Board of Certificate and State Licensure Board. And these are my references.